I'm an optometrist with Med Optics Vision Center, and I'm going to talk through about cataracts today. Cataract is also commonly known as ensenke in the local languages. So what happens when someone tells you you have a cataract, it means your lens, or what we call the akalawulikeriso, or it's getting opacities. That lens of the eye, it's usually supposed to be clear, so that when the light is coming from outside, it can go through to the back of the eye, then you can be able to see the image, or then you're able to see whatever you're trying to look at. What happens when you have a cataract is the lens starts getting a bit of opacities, or it starts having some deposits that are coming onto it. Then when those deposits keep on accumulating, they start opacifying, or they make that lens opaque. In that case, it's just like when you're looking through a window and then the person maybe or someone puts the curtain down, you will not be able to see what's behind. So that happens when you have a cataract. The window of the eye, or the light where it's supposed to be passing through, it's cut off, so you will not be able to visualize, or you will not be able to get enough light at the back of the eye. Then your vision will start diminishing. But it doesn't necessarily mean that when someone tells you you have a cataract, your vision is going to go all at once. Cataracts come in stages, or you can have it and it keeps on developing over time. So the first time you go have an eye examination, if you're told you have a cataract, it doesn't mean that there and then we have to start the management, which is in most cases the surgery. But in most, we just have to follow up. We look at the vision, we see how your vision is responding, how much vision you still have left, and then depending on your vision needs, we can always recommend further assessment or further management, which is always the surgery. So when we look at cataracts, the main causes of the cataracts, most of them will come with age, though that doesn't necessarily mean that it's only old people that will have the cataracts. You'll find that there are people who are actually younger and then they have the cataracts. There are people who are born with the cataracts. Those are the ones we call the congenital cataracts. And then cataracts can also come from trauma. Let's say someone has hit your eye, something has pierced your eye, you can easily develop what we are calling the cataract. But in most cases, you'll be seeing them in people who are a bit older, or people who are a bit older in most cases. Though they can also be associated with other body conditions like the diabetes, the hypertension, but those are mostly due to also the side effects of the medications you're going to be taking. So cataract, it's something that affects your vision, but it doesn't or take away the vision all at once unless it's due to trauma. But other than that, the cataract will keep on developing in stages, and we monitor that by having the vision checked to see where stage it has reached, where you are at where the vision is, how much your vision has been affected. Yeah, so for the cataract, when we do the assessments, or when you go in for your routine assessments and the exam, and the doctor finds out that maybe you have the cataract or you have some opacity within your lens, if it has started affecting your vision, they will recommend surgery, or they will tell you to go see an ophthalmologist who will do another assessment, then see how well your eyes are fit to go for the operation. So when we assess and we tell you have a cataract, but your vision is not affected, or your vision is still okay and you're still comfortable with the way you're seeing things, we shall not tell you to go for the operation there and then, but then we shall recommend that you continue having your eyes checked routinely. Depending on how big it is, we may recommend you do it once a year. We can say you come back in 6 months just to see the progression. So when we check and the vision is being affected, or you're having challenges with your vision and glasses can't help anymore, we shall recommend that you go in for surgery. When the cataract is removed, the surgery to remove the cataract, it's always an easy procedure. It's not something so complicated. They'll just remove the opaque lens, put in the artificial lens, and then most cases you'll have to accompany that with glasses afterwards. But the basic thing is to remove the opaque lens and put for you an artificial one. What people there will say the cataract surgery is risky, But like any surgery, there are some risks involved, but the cataract surgery is supposed to be something easy, something simple. And then the cataracts are not treated with eye drops. Cataracts are not treated with changes in lifestyle. Cataracts, the management we have is to remove them or to remove the opaque lens and put for you an artificial one. Then after the cataract surgery has been done, you'll still have to follow up with your optometrist to check and see whether the vision can still be improved more with the glasses. After every surgery, you'll find that if maybe your distance vision is okay after the cataract surgery, you may need the glasses for reading. If you find that, or if they do the cataract surgery and your near vision is okay, you may still need glasses for the distance vision. So for the cataracts, the basic managements we have is we have to have the eyes assessed, see the level of the damage that has been caused by the cataract, how much your vision has been affected. Then depending on how much the vision has been affected, we shall recommend that you see an ophthalmologist. The surgery will be done, then you'll come back to the optometrist, have the eyes assessed, then we get you a pair of glasses to improve either the distance vision, the near vision, or both, depending on how good the surgery was done.